So when we look into the Vyadhija Phakka, we have seen that FTT may be because of a lot of disorders, isn't it? Metabolic disorders, chromosomal disorders, structural disorders, congenital disorders, and then some of the infectious disorder, endocrinal disorders, okay, some of the surgical disorders, lot of causes, jora, etc. disorders, many things are explained in the Vyadhija Phakka. Okay, so now usually Vyadhija Phakka is not a disease of the infantile period or not a disease of toddler period. So this is in the later part of the preschool period. Okay, it may occur in the preschool period or in the school period, school going age period. Okay, so now what is explained in the Vyadhija Phakka is this is nothing but a FTT which is developing because of the different type of disorders, musculoskeletal, all the type of disorders. Okay, therefore the name Vyadhija Phakka is given. So he says that Nijagantubishchaivaha jvaradibihi, all the disorders, all the Nija disorders, all the Agantuja disorders, jvara etc. disorders, infectious causes, whatever, may all lead to this Vyadhija Phakka. Okay, so whatever the big table which is explained for failure to thrive like condition has been explained in one single line by Kashyapa. Okay, all the Nija Rogas, all the Agantroga and jvara etc. disorders may lead to FTT when it is not properly handled. Now, apart from that, he explains Anatoho Klishyato Balaha Kshirna Mamsa Baladyutihi Samshushka Spik Bahu Uru Moho Udara Shiro Mukaha Pitaksho Shrushitangascha Drishamana Astipanjaraha Pramlano Adakayascha Nitya Mutra Purishakrutahe Nichesta Adakayovaha Pani Janu Gamo Apivaha Dorbalyat Mandachestascha Mandatvad Paribhutakaha Makshika Krimikitanam Gamyascha Asanna Murtiruko Vishirna Rashtaromacha Stabdaromaha Mahanakaha Durgandi Malina Krodi Phakka Shwasati Tamyati. Phakka Shwasati Tamyati. Tamyati means Tamapravesha, towards. Then Ati Vinmutra Dushikaha, Ati Vinmutra Dushikaha, Singhanaka Malodbhavaha, Ityete Karanad Vyadhijam Phakka Tam Shishoho. This is actually explained by Kashyapa. Now, see, if you look into this shloka, we cannot study this shloka as it is because there is mixture of so many things. Now, we need to break it and also we need to categorize it in a proper way so that we can study it properly. Now, this is one such attempt. Vyadhija Phakka. This is nothing but different disorders which is leading to failure to thrive like conditions. Okay. Nija Agantubishchaiva. This includes all the systemic disorders, toxicity, environmental hazards, surgical interventions, etc. So when I say Nija Agantu, Agantu means from the outside cause, Nija means from the inside. Now, different physical, surgical, external, nutritional, chromosomal, congenital, neurological, endocrinal, neoplastic, locomotor, musculoskeletal, psychological disorder leading to Phakka is considered under the one heading of Nijagantubishchaiva. Next, he says Jvaradibihi. So, Jvaradibihi refers to different infectious causes leading to FTT because we know that there will be immunocompromised state and immunocompromised state will go into lead to different types of vulnerable infections. Okay, opportunistic infections. So that every infection brings the baby very near to FTT. Okay, so now different types of infection. It may be different types of fevers. Some of the chronic fevers, encephalitis, meningitis, typhoid, malaria, tuberculosis. We know post-meningeal sequelae. We know that. Post-encephalitis sequelae. We know that. Okay, tuberculosis. With every episode of infection, the growth velocity chart of the child will go into fall. That we know. If the child has a recurrent respiratory infection with the immunodeficiency, definitely the growth velocity chart will go into fall. Okay, that itself is the main indication that something is going wrong. Sometimes even in the viral infections, there are repeated viral infections will be there. But if you look into the growth chart, there is no fall in the growth chart. Then you are happy. So what is the main criteria here? Growth chart. Repeated infections can occur because of immunocompromisation, immunodeficiency, or because of bacterial infections. Or sometimes even in a normal child also there will be repeated respiratory infections. Mother will be worried. Okay, so then to console the mother, you look into the growth chart. If the growth chart is okay, then no problem. No, with the infection growth chart is falling, then it has to be taken seriously. So this is one of such condition. Now, again they explains one more important word, that is anatoho klishyate balaha. Okay, anatoho klishyate balaha. So now this anato klishyate bala indicates the social causes of Phakka. Now if you see in the contemporary science, there is a theory called as Gopalan's theory. The Gopalan's theory explains about the interaction between the body and as well as the environment and the society being a cause for the FTT. Okay, so now a similar kind of explanation is given in Ayurveda also when they say anato klishyate bala. If you look into the shloka, anato klishyate bala kshinamamsa baladyutihi. So that means these FTT like conditions are very common in anatha. Anatha means there is nobody is there to take care of the child. No father, no mother, and no other caregivers. Okay, so in this condition now situation, the word anatha carries wide variety of meaning. Okay, so this may indicate the different types of the social causes. So this may be indicating towards the orphan child. Okay, when I say anatha child, this may be orphan child, this may be a neglected child, or child abusers, child exploitation, familial conflicts. Okay, mother and father both are separated, divorced, and nobody is there to take care of the child. So that is also anatha only. Child is anatha only. Although father and mother is living, if they are not taking care of the child is not in their custody, then again it is anatha only. Okay, familial conflicts. Then gender differentiation, sometimes male child, female child differentiation still existing in India. So this may lead to this type of problems. Then multiple children and also single parents or divorce, etc. All such social and familial situations in the present situation can be taken under the heading of anatha, word anatha. Now, if you go further, Kashyap explains some other, that is pradushta grihnikascha prayasho bahubhojinaha Phakka bhavanti tasmascha bhuktam tesham aparthakam. So now here he is highlighting another important cause of Phakka Roga, especially Vyadhija Phakka. What is it? Malnutritional disorders. We have seen the environmental causes, we have seen the surgical causes, we have causes different disorders, we have seen the different social causes like anatha, etc. Now he is explaining about the malnutritional causes. So what he says, malabsorption and malnutritional causes as the cause of FTT. Okay, pradushta grahnikascha prayasho bahubhojinaha Phakka bhavanti tasmascha bhuktam tesham aparthakam. That means child is eating too much. Okay, but still child is not gaining the weight. The problem is quite obvious. What is the problem? There is a problem with the malabsorption. Okay, child intake is very good, but according to that, child weight is not increasing. Definitely there is problem in the assimilation and as well as utilization. Malabsorption problem is there. Okay, now he says the word pradushta grahani. So that means the agni is affected. Okay, grahani is affected. So child is not able to digest, not able to assimilate, not able to utilize, and end products of the food is not formed. Okay, so this is the one possibility. Now where this is possible? So this is possible in all the metabolic disorders. Okay, we have got different metabolic disorders, protein metabolic disorders, carbohydrate metabolism disorders, and fat metabolism disorders are there. Inborn errors of metabolism. Okay, different acidureas, etc. So where there is actually the problem is there with the utilization of the food. Okay, so grahani roga in this context it suggests towards different inborn errors of metabolism, and sometimes even some of the surgical condition. After surgery there may be a problem in the absorption of the food. Okay. Because surface area of the intestine is reduced, and that may lead to some of the problem. Or this may also refers to the congenital malformation related to GAT. Okay, Meckel's diverticulum and some other congenital problems related to the GAT. Then Crohn's disease, maybe ulcerative colitis, reflux esophagitis, duodenal atresia, food allergies, and hypersensitivity. So all these conditions where the food absorption, food utilization is not proper and metabolism is not proper can be taken as a pradushta grihani kasha. So why he says prayasho bahubhojina? Kashyapa says he is bahubhojina. Child is having very good intake. Okay, but he says tasmascha bhuktam tesham aparthakam. Whatever he is eating, that is getting wasted. Whatever he is eating, that is getting wasted. Bhuktam tesham aparthakam. Okay, and because of this, what he says, bahumutra purishana. He is eating more. not utilized, but there is more formation of the urine and as well as stool. That means that whatever food he is taking, ahara rasa he is taking, that is not get converted into rasadhatu, rather it is converted into kittabhaka. Okay, therefore there is more production of mutra and purusha. Mala is more, ahara mala is more, but ahara sara is less. Okay, and that leads to this particular problem. Okay, so mandagnitvat, rasogsvargat. That means there is formation of the amarasa and there is also mandagni, which leads to all these problems. So all malnutritional, malabsorptional disorders which are mentioned in the contemporary science can be included under one single heading, that is pradushtaghrani kasha. Okay, so this is the nutritional cause which leads to Phakka Roga or failure to thrive like conditions. Now, here he explains one more important thing. What is that? Bahu bhojinaha bhuktam tesham apartakam bahu mutra purishana. This is what I told. Whatever he is eating, that is getting wasted and it is not utilized, and there is more production of the aharamalas. Okay, so excess eating without weight gain is there. Now, for this contemporary science, usually to understand the malabsorption and malnutrition disorder, they usually follow a trial and error method. What is that? In the contemporary science, a trial and error method is followed, which is exactly fit with the explanation given by Kashyapa. So what he says, give the standard diet, a child which is diagnosed as FTT, give that child a standard diet, which is complete food, containing all the components, standard diet for 2 weeks. And after 2 weeks, observe the weight gain and stool pattern. Okay, so when ahara rasa is not formed, there is no dhatus are formed. We know that. When there is no dhatus, there is no shukra dhatu. Rasa dhatu is not formed. Then rasa, rakta, etc. is not formed. Mamsa is not formed. Then ultimately shukra is not formed. When there is no shukra, there is no ojas. So when there is no ojas, so it is nothing but the immunocompromised stage, and that leads to Phakkatva. Okay, now contemporary science follow a trial and error method. They give the standard diet for such patients for 2 weeks, then they observe the weight gain and stool pattern. Okay, now if the weight gain is good, then it is concluded that the cause of this FTT is poor nutrition. When you provide a balanced good nutrition, the things are okay. Now after two weeks, you have provided a good amount of caloric food. In spite of that, the child is not gaining the weight, then they have to see the stool. If the stool contain the unabsorbed materials, so that suggests that this is a malabsorption disorder. So this is how they will go to differentiate malnutritional, there's poor nutritional and malabsorptional disorders. Almost a similar method is explained by Kashyapa by telling that bhuktam tesham apartakam. Okay, bahu mutra purishanaha. Stool amount is more, mutra amount is more. Similarly, the contemporary science also, they look into the stool pattern. So this is all about the three or four important causes related to the the Phakka Roga. Now the next part, we will consider the pathogenesis of Phakka Roga. This is very important. If you look into the slokas, the pathogenesis of Phakka Roga should be now understood.